Hello, I'm Diana Keogh, Editor-in-Chief of Sharewig.com. Today we're talking to Leslie Heinberg, who is the Director of Behavioral Services at the Bariatric and Metabolic Institute at the Cleveland Clinic. Leslie has agreed to take questions from our members that have come in over the internet about the psychological effects, or really what is discussed before bariatric surgery. Our first question, Leslie, has come in from Facebook. My husband is considering bariatric surgery, but we have two friends who've had it and gained the weight right back. What is the responsibility of the patient to keep the weight off?
So the good news is that the vast majority of patients who have bariatric surgery are able to keep their weight off successfully. Most people only regain about 5% of their excess weight loss. However, there are a number of behavioral factors which can impact success over time. Continuing to exercise, continuing to keep the diet that was initially prescribed leads to success for almost all patients. One of the things you may want to consider with your husband is how these friends have adjusted to their surgery. Are they following recommendations? What can he potentially learn from not only their successes, but also what may have led to some of the failures?
Leslie, this question has come in from Twitter. In your experience, how does a patient have the best results? What kinds of things are needed to be in place for their success?
Well, patients have the best result when they're best prepared for surgery. They need a lot of education, they need a lot of support prior, but they also need that after surgery. People who get involved in support groups, people who have supportive families and work environments, and people who are involved in multidisciplinary care from their bariatric program before as well as after surgery tend to have the best outcomes.
And this question was posted on our website. What are some of the reasons a patient is turned down for the surgery?
Well, most patients aren't turned down for surgery. Most patients are able to address whatever contraindications they may have over time so that they can be ready for surgery. There are a number of medical contraindications so that patients really need to be healthy enough for surgery. And then there are some psychological contraindications. Patients need to be free of problems with drugs and alcohol. They need to be psychiatrically stable, and they need to be emotionally ready and prepared for the surgery.
Leslie, I understand that once you have the surgery, there are certain foods that you need to avoid really for the rest of your life. What are those foods?
Regardless of the type of surgery, patients need to be prepared to follow a fairly strict dietary guidelines after surgery. Foods that are high in fat, foods that are high in sugar, or foods that are filled with empty calories that aren't nutrient dense should be avoided, not just immediately after surgery, but permanently. There are other items like carbonated fluids, caffeine, nicotine that also need to be avoided permanently after surgery.
Leslie, thank you so much for joining us here on Sharewig.com. If you'd like more information about bariatric surgery and the psychological testing that goes on beforehand, please go to our website at www.sharewig.com.